headlines now, we're talking about Ebola. How prepared are we from a public health perspective with regard to preparedness, especially when it comes to Ebola, given that it's only been suspected cases? Brown.
Thank you, Fred. It is a sad situation in this country because particularly when we're talking about Ebola. Ebola, you have to know that that's a highly contagious disease. It actually is a viral infection that's actually highly fatal, and it actually can be able to lead to a lot of fatalities in the event it's actually mismanaged. And I want to say that in this country we have not reported any case of Ebola. Remember, COVID-19 really taught us a lot of lessons that really, from the public health front, is actually very, very important to be able to know how to be able to deal with this is of such a magnitude. And it is actually a sad situation because it's actually coming in when we're actually having very poor public health infrastructure in this country. We're talking about weak enforcement systems. We have not actually set out actually very, very, we look at that, even at the healthcare component, the HRH component. We're actually talking about a healthcare system that actually is not actually in good shape to be able to really address those challenges. And when I say this, I mean we're actually having a lot of gaps in terms of the HRH. We're actually having a lot of gaps in terms of even the preparedness itself. Even look at the people, for example, from their perspective point of view, because they're talking about the risk communication, because there are actually a lot of fears surrounding the whole of this issue about Ebola. And therefore it is actually coming in at a situation whereby it's very unfortunate. And I'm going through the dailies, and I don't know whether it's true or not that I allowed US to bring Ebola patients.
Well, the president has confirmed
itself. It's actually a very unfortunate statement.
And we'll discuss the dangers.
Yes.
We'll discuss the dangers, if at all, and the risks involved in having confirmed cases of Ebola, because it means that if that quarantine facility is to be used, then Kenya will have recorded its first case of Ebola. But we've come from a pandemic just the other day, Bill.